All right, hi everybody. Welcome to Webinar Wednesday. Good to have you all here. Just some housekeeping type stuff. We are scheduled through February for Webinar Wednesdays, so we have 3 more upcoming after this one. The 27th of January, Love Your Brain is coming. They are going to have a different speaker other than Shiloh, and they're going to kind of talk about their new mindset program that they're offering through Love Your Brain, which is a virtual yoga program that you can sign up for as a survivor and get access to all their things for free. So this is a great opportunity. So they're going to kind of explain everything to us. Then on February 10th, we're going to have post-acute medical, which is actually was called Cobalt in Fargo, and they've had a name change. So they just kind of wanted to update their webinar because we have an old one on here from Cobalt. And they're going to give us a virtual tour and kind of show us all the neat technology that they have to offer for rehab options for brain injury. And then Ala Lisk is also coming back on February 24th and kind of talking about some of the primary symptoms that brain injury has. So today's webinar is from Jessica Kersey, who is an OT and a PhD candidate at the University of Pittsburgh. And she was set up with me through Emily Kringle, who did one of our last webinar Wednesdays kind of on not being sedentary after stroke and how that can really affect your outcomes. And so they're pals, and so they introduced me to each other, and so that's how we came about them. But Jessica was actually unable to be here live today with us, so she and I pre-recorded last week. So I'm going to just share my screen with you and show you her pre-recording. It's pretty short, it's only about 28 minutes, but if you have any questions, let's hold those till the end, just with the 2 screens and everything. That will just help for my management style. So if you could just jot questions down as she's talking, then we can definitely have some discussion time at the end. But I'm gonna pull up my other screen here for everybody. You see that okay? Yeah, okay. All right, and you might need to adjust your own volume. Let's give the volume a try here and just make sure, but I think we should be good to go.
Hi everyone, my name is Jessica Kersey. I am an occupational therapist. I have been for about 12 years now, where I've worked in both inpatient and community settings with people who have had a traumatic brain injury or stroke. I'm now also a doctoral student at the University of Pittsburgh, where I am learning how to transition into the research side of occupational therapy. And one of the reasons why I chose to do that is because I struggled as an occupational therapist with how much we focus on helping people return home from the hospital and ease that transition, help people learn to be independent within their homes. But then we don't always do as good of a job, it seems, with getting people back into the community and getting people engaged in their communities, and at least some semblance of the way they were before. So I have chosen to pursue my research track, exploring how we can facilitate that transition back to the community as well. Which, one of the questions that I was faced with when I first started this journey was, what exactly is community participation, and what exactly is it that we're trying to accomplish when we say that as therapists? And one of the things that I've learned is that it's different for everybody. Community means something different to everybody, whether it's the places that you go or the people you interact with. And there's a really important element of what's meaningful to each individual person that determines what their community participation is and what that would ideally look like. So a couple things for you to just think about as we move forward in this presentation. I'd like for a second for you to think about, what does community mean to you? What is it that you like to do or that you want to do in your community? And why is that meaningful to you? And that idea of what's meaningful to you is something that I've gotten really excited about over the last couple of years, and I'm really trying to explore deeply with my research. So not just what do you want to do, but why? Why? What is the purpose behind those activities? So we, in therapy, have historically thought about community participation as the things that you do when you leave your house. We've always thought about it primarily in terms of three main areas. So that would be work, whether you're doing paid work, volunteer work, school for some people, those all fall under that domain of work or what we consider to be sort of like those productive activities. The second is what we call instrumental activities of daily living. So this is all the things that you have to do to manage life. Going to the grocery store, going to the doctor, managing your banking and your finances. And then the third domain is socialization. So what are the things that you like to do for fun with other people or to relax? So we've always kind of thought about it in terms of those three main categories of activities. And those are the things that drive how we work with people in rehab. So one of the important things that we do as therapists is to do assessments so that we can figure out where we're starting and what we need to work on to help people achieve their goals. So we have some assessment tools that ask people about their community participation. But the ways that we ask about it are not always very useful. So the most common way that we ask about it is, how often do you do these types of activities? The problem there is, like I mentioned before, participation in the community is different for everybody. And sometimes people might only choose to go maybe out to dinner once a week, and that's when they choose to leave their house. Where other people may leave every day to go to work, drop their kids off at soccer practice, have coffee with a friend. Everyone's participation looks a little different. And so how often you engage in different activities doesn't really apply to everyone equally. We can also ask about how difficult specific activities are. Excuse me. But when we look at that in terms of how we use assessment tools, it again falls a little short because each assessment asks about very specific activities. And so if those aren't the activities that you're really worried about or the ones that you prioritize, we might not notice that there's really this glaring problem because it's not one of the activities that we asked you about. We can also ask about how much help do you need to complete different activities, which does tell us a little bit more in terms of difficulty as well. Is it difficult enough that you need help? And then it also has an important component in that it tells us how much support is needed. And that could be a really important barrier to how well people are able to engage in their community. But even among those three questions, it still doesn't really get at all of the important pieces of what community participation means. So with that in mind, there have been a few recent research studies that have interviewed people with a range of disabilities, particularly disabilities that often result in cognitive impairment. So most of these studies included people with traumatic brain injury, with stroke, and then some also with people with spinal cord injuries. And basically these studies asked people, or do our ideas of community participation align with your ideas of community participation? Or what does community participation mean to you? And we got some ideas, some feedback from them that it really wasn't at all the same, that their ideas of participation meant something very different and was not really focused on activities the way that we have been thinking about activities. So two of the big themes that came up frequently in several of these research studies were these ideas of respect and dignity, being treated like you're actually a member of society and not being treated differently based on your disability. So among those, there were several sub-themes that emerged across a few of these research studies. Meaningful engagement is one that maybe did overlap with our ideas a little bit about what community participation is. Are you able to engage in activities that are meaningful to you, and do you do it in a way that you want to do it? Also is this idea of personal responsibility. So are you able to do the things that you want to do for other people? And that could include things like being able to go to work every day to provide for your family. That could include caregiving roles for children or grandchildren. All these things that you want to take responsibility for. Similar to that is supporting others. Are you able to provide caregiving roles, provide emotional support, help other people with things that they need in a way that's just meaningful. And then there was this sense of inclusion or membership in society. Do you feel like you belong in society? Was a big thing that came across in a lot of these research studies. Another one that was interesting was access and opportunity. So not only, can you do these things that are important to you, but are the things that you want to do actually accessible to you, and do you have the opportunities that you need to be able to do the things you want to do? And then lastly, there was this sense of choice and control over the way that people participate in my life. So to what degree do you choose what activities you want to do, when you want to do them, who you're with when you do it? Having that sense of choice and control over your life. So those were some pretty eye-opening results that aren't very well represented in the way that we provide therapy services usually when we're considering community participation. And this idea of sense of belonging or inclusion is one that was explored specifically in one research study more in depth. And they identified a few important pieces to a sense of belonging. First is that you feel that you're able to contribute to your community. Next, that you feel that you're valued by your community. And lastly, that you feel that sense of choice and control that came up again. So those are three important ways that contribute to how much you feel a sense of belonging or inclusion in your community. So I'd like for you to think for a few minutes, reflect a little bit to see if that resonates with you. Do you feel like you contribute to your community? Do you feel like your community values you the way you are? And do you feel like you have a sense of choice and control over what you do and how you interact with your community? I would be very interested, I'll give you my email address at the end of this presentation, but I'd be really interested to know if this resonates with you or not. We've seen this come up quite a bit, but then we've also had a few people who said, I don't know if that's really it for me. So I'd be really interested to know your thoughts on that, how much that resonates with you. Feel free to email me. So then there's this question of why is this even what we're working on? So we found that community participation, if it's a problem, if you're not really engaging well in your community, sometimes people get into this really bad cycle where if you're not engaging in your community, you kind of end up being less active if you're just at home and not out and about. You can end up feeling more lonely, and together those things can lead to more depressive symptoms. Together those things can all lead to less of a quality of life, and then even less community participation, because if people are not, a lot of times people with depression tell us they just don't have the motivation to get out and do things. So then that feeds right back into that cycle of poor community participation, leads to more depressive symptoms, leads to even worse participation, which leads to even worse depressive symptoms, and it just gets worse and worse. So that's one of the reasons why we feel like this is a really important problem that does also have, some significant impacts on health. If you're not active, that can lead to higher rates of other health conditions, including stroke. If you've had a stroke, that can lead to a secondary stroke as well. So those are some of the things that we really want to try to prevent. But in particular, that quality of life piece will make a big difference. So based on learning all of that at the start of this program, I helped design and implement a research study to try to learn a little bit more about the problem and what we can do. So the idea was to try to understand more about what people think about community participation. What are some of the problems that they encounter that prevent community participation? Do people think that we're measuring it well with our current assessment tools? What exactly is it that people want to be doing better? And then what are some of the barriers that are preventing people from engaging more? So we enrolled 61 people who had traumatic brain injury. And the first thing we did was ask them about their goals. what are the things that over the next 6 months to a year you would really like to achieve or be doing better? And these were their results. So we classified their goals into some different categories and then calculated how many people selected those different types of goals. So at the top, the darkest section there is self-care. And when we say self-care, we're typically thinking in terms of being able to take care of your basic needs, like getting dressed, going to the bathroom, brushing your hair, brushing your teeth, getting ready for the day, getting around your house. Mobility is that tiny little sliver. That's another thing that we tend to focus a lot on in rehab, which is just anything from getting stronger to improve your movement to actually being able to get up out of the chair and go somewhere else within your home. So those are two of the things that we really focus heavily on in rehab settings. But you'll notice that those are two small slivers in terms of the whole pie. So we're really spending a lot of our time addressing things that are not people's primary goals. What we saw as the biggest chunks of goals that people set were in terms of work. So people either wanted to find a job if they were unemployed, or transition from part-time work to full-time work, or volunteer work to paid work, or find a higher paying job. We saw a lot of people select goals related to active recreation, which we think fits in really well with community participation, getting out and doing things outdoors that are active, and socialization, which again seems to align pretty closely with how we think about community participation. So that was exciting to see that people were selecting a lot of goals related to community participation, which made us think, we're on the right track with at least thinking about something that's important to people. But are we really addressing it well in therapy if, the things that we're really working on still only a small slice of what people's goals are? We next asked about barriers. What are some of the things that you think get in the way of being able to participate more in your community? So what we learned was that depression was a big factor. Depressive symptoms were a big factor, which was unsurprising considering what we've read from previous studies, that a lot of times people just can't get the motivation to try to take on difficult community activities. We found that accessibility was a really big factor. And usually when we're thinking about accessibility, we're thinking about physical accessibility of spaces. So for instance, in the picture, the woman is in a wheelchair and is facing a big flight of stairs. We primarily conducted this research with people in Pittsburgh, which is an old city and has a lot of buildings that are not accessible despite the law, because they've been grandfathered in. So that is a factor. But what we learned is that it's a lot more than just physical accessibility too. A lot of times people have told us, I'm trying to go to the mall, it's a big building, I can't find the directory, I can't read the directory, there are too many people and too many loud noises and bright lights. So even from a navigation perspective, or all of the sensory stimuli that are in a building, big building or a crowded place, make places inaccessible, even if you don't need a wheelchair or if the physical space is not so much of an issue to get into. We also found that things like transportation were an accessibility barrier. People didn't always have a ride, or if they did, they were kind of stuck waiting on someone else's schedule versus doing things on their own time. And then also we heard a lot about information accessibility. Having the resources and the information presented to them in a way that was easy to understand was also a problem that people felt like influenced their ability to participate in meaningful activities. Lastly, we learned that social support was a really big factor. We looked at some of our people who had really good community participation, or felt that they had really good community participation. And by and large, those people had very good social support. And we also looked at our people who did not have really good community participation, and by and large, they did not have good social support. So that seems to be a really important factor as well, which makes sense considering some of those barriers to accessibility. You know, if someone's able to drive you when you're ready, that will help. If someone's able to help you navigate a busy space that otherwise would be hard to navigate, that could help find solutions to physical barriers to the space. So it makes sense that social support is important, but unfortunately that's something that a lot of people don't have. So what does all of this mean for us? One of the biggest things that we took away from this is that we can't just work on movement and thinking. And those tend to be two of the most important things that we focus on in rehab following brain injury and stroke in particular. There are two of those things that people are really surprised by. I'm not moving as well. I'm not thinking as well. I'm really struggling with my memory and my concentration. And those things are important and things that we can and should work on in therapy. But there's a much bigger picture that we also need to be paying attention to in terms of trying to get people back to their important daily activities. So that told us that we really need to think about other barriers as well and try to help our clients figure out strategies for managing some of those other barriers. There was a team of researchers at Washington University in St. Louis who came up with this idea of factors that are inside me versus outside me. And I felt like this was really relevant to our discussion of community participation, because some of those factors that people told us about that were barriers weren't necessarily things that were the inside me factors that we usually address in rehab. So for example, inside me factors are anything that occurs inside of your body and the way that your body works. So things like your movement, your weakness, coordination. If you're having pain, that influences what you can do. Changes in vision, things like fatigue or a loss of endurance. And then certainly difficulties with memory, communication, and concentration. These would all be considered inside me factors. And these are things that we spend the vast majority of our time in rehabilitation addressing. And again, they're important, but they're only part of the picture. And the other part of the picture are the outside me factors. And these are the factors that don't have anything to do with what's going on within your body. So these could be economic factors. If you have financial resources or not, that could make a big difference. Employment, not only are you employed enough so that you have financial resources, but how supportive is your workplace? How much flexibility and freedom do they allow you? Certainly accessibility, weather. A lot of times people say that they're affected by cold or heat. That makes a big difference. Transportation, access to information, technology can sometimes help or hurt. Again, social support is a big outside me factor. Then services and systems play a really important role here. Things like support networks, rehab programs, community programs, services that are in place to help provide things like transportation or outings. And then lastly, civil rights and legislation. So something like the ADA made a really big impact on a lot of people, but then there have been instances where it hasn't really helped some people as much because of the way that it's been implemented and enforced. So the way that those things all play out within your environment and your community can have just as much of an impact on your community participation as those inside me factors. So I liked this example. I know a little hard to sometimes understand the first time you hear it. I can give you one example of a woman who had a stroke who I was working with recently. She lived at the top of a big hill, and there's a farmer's market at the bottom of the hill, and she always loved to go to the farmer's market and wanted to try to go. And she had a plan for how she was going to manage all of these, the hill, walking down the hill, and where she was going to sit to take a rest. And she had her plan in place for how to manage at the farmer's market, but just couldn't quite get back up the hill. And she would talk about how on so frustrated. I just don't have the strength for it. I just can't walk well enough to make it back up the hill, focusing on all those inside me factors. And then one day she said it a little differently, where she said, if the dang hill wasn't so steep, I'd be able to make it up. And that was the first time that I heard her talk about anything in terms of the outside me factors, where sure, you're struggling a little bit with your walking, but you're able to make it down and you're able to make it around at the farmer's market while you're there. So really the difference then is the outside me factor of the steepness of the hill. So I think that's an important distinction to consider, because then that triggered me to think about, well, what are some of the alternatives that we could figure out to just manage that trip back up the hill? Could we find an alternate route that's less steep, or that maybe has more options for resting? Is there a bus route that goes up the hill, or we could just avoid that altogether? And that gave us more to consider, more to think about, rather than just thinking in terms of her weakness and her difficulty with walking. So I think that's important for the brain injury survivors and the stroke survivors in the room to think a little bit more broadly about strategies and things that can be managed, and also for therapists to not forget about some of those outside me factors that we can also discuss in therapy. So some of the things that I'd like for our brain injury survivors to consider, and you can email me your responses if you'd like, and we can chat about them if you'd like. But what are some of the things that you want to do in your community? What are some of the outside me factors that contribute? I'm sure it's a lot easier for everybody to think about the inside me factors, because that's what we spend so much of our time thinking about and doing in rehab. But what are some of the outside me factors that might come into play with some of those important community activities? And then lastly, based on those outside me factors, is there anything that you think you could change or do differently to be able to manage those factors more easily? So I'd like for you to think about that after this session and share with me your ideas, or share with each other your ideas. See what you come up with. So based on the work that we did in that study, we did realize that we aren't really measuring people's community participation well either, like I mentioned earlier. So the next step that we're working on now is trying out a new assessment tool that is much different than what we've used before. So this one doesn't focus on specific community activities. It focuses instead on that idea of sense of belonging, sense of inclusion. So it asks questions about your sense of choice and control, how much you feel like you're valued by your community, how much you contribute to your community in a way that you find meaningful. So the questions are very different. We are looking now that assessment tool was made a few years ago, but we're really working on it now to figure out how to use those results in clinical practice. So we need to know, first of all, if there's a certain score that you need to be able to have what we would consider to be good community participation. So people who are happy or satisfied, those people score in a certain range above or below a certain level, so that we would know when we might need to consider therapy or rehab intervention based on a certain score. We're also looking to make sure that we're actually measuring what we think we're measuring with this tool, and making sure that we're getting reliable results. And then we're also trying to see if it will actually detect changes. So if you improve with your community participation, or if you feel like your community participation has gotten worse, based on how you feel about it, will the results of the test show that change? So those are some of the things that we're looking at, so that we can make it a little bit more friendly for use in therapy settings. So that study is still going on. We're recruiting for the next couple of months. I have some information here if anybody is interested. It can all be done virtually via telephone or Zoom. We ask you to complete some assessments. This says on here 60 minutes, but they really take about 30 to 45. We ask you to do them twice, 3 months apart. So if you have questions about whether you are eligible, or if you're interested and would like to know more, please feel free to email me. And I would really like for you to send me your thoughts. I really wish I could be there in person to have this discussion with you, or at least live to have this discussion with you. And I apologize that I can't be. But I'd really like for you guys to maybe discuss amongst yourself, or reflect a little bit on your own to see what do you think is the best way to decide if you have good community participation. How do you know when you feel satisfied or unsatisfied? What is most important to you when it comes to participation? Is it specific activities? Is it a general sense of belonging? What is it exactly that's most important to you when it comes to community participation? And then what are your highest priorities as you progress through rehab and beyond? What is it that you really want to try to accomplish? So that's all, I think, really important information that we would like to know moving forward so that we can make sure we're on the right track. And just in general, do you feel like this makes sense to you? And do you feel like it's something that's meaningful to you for us to even continue to explore? So those would all be good things for us to know, and I'd appreciate your feedback. That's all I have for us for today. That was a lot shorter than I was expecting it to be. I think I talked a little too fast, but hi everyone, my name is Jessica Kersey.
All right, guys. All right. So that was her presentation for you. And I thought we could kind of visit about some of those prompts she gave us if you'd like. Yeah. I know a lot of you aren't survivors, but I think that's okay. Even those of you that are providers, what do you think about, the best way to determine good community participation? Do you guys have certain tools you use to gauge that, or it's kind of more self-reports, or?
One of the things I was thinking about is your participation. If they're asking the question now, it's going to be a lot less than it used to be.
Yeah, and I think this would be considered like a pre-COVID or after COVID kind. I think we have to kind of, think of it in terms of no COVID, if possible. I don't know if that's possible. It's hard to kind of change our mindsets right now, but that's the interpretation I took away from her too. Yeah, she really didn't mention COVID at all, but that definitely has an impact on all of our community participation right now.
I could speak to something, Carly.
Sure.
I'm a physical therapist at Heart Springs Community Healing Center in Fargo, and everything she talks about completely resonates with me. And that is one of the reasons I just love that setting so much. And when you talk to people, what is important about Heart Springs and what is different and unique, it's that connection with each other, that feeling of belonging, that feeling of having a family. So it's very, very interesting. Or if I have a class with Tai Chi Cha, we often go around and talk about how it's benefited us if we have new people. And as a PT, I'm thinking, oh, maybe somebody will say something about balance or weight shifts or something like that. But it's always, that we're meeting together in a group. We have this connection with each other.
Sure.
So it can be kind of intangible, but I certainly agree with her how important that piece of the puzzle is. And we don't often get that kind of in traditional settings necessarily. So I'm really grateful kind of at the end of my career that this is kind of what I've stepped into now for quite a few years.
Good.
So I'm looking forward to connecting with her out in Pittsburgh.
Yeah, please do. She really genuinely wants that. So she was bummed she couldn't be here today, but yeah, definitely reach out and do any of you see yourselves participating in that study? And doing
yeah, I can see some nice links with Heart Springs.
Good, yeah. If you wanted to even get the flyer from her and advertise it, print it out. Yeah, and post it.
I do
Yeah.
have a question for Barbara.
Say that again, JP.
I said, I do have a question for Barbara.
Oh, go ahead.
Have
Yeah.
you and I ever met? Because you mentioned two things that actually affect me, and the balance, memory issues. Um, anyways, I just wondered if we'd ever met.
Oh, I don't think so, unless I would have met you at a support group, perhaps at Progressive.
It's
Yeah.
just that it's just that you hit something that's really kind of close to me.
Okay,
Mhm.
I've seen you on webinars before, but I don't think we've met. Are you from Fargo?
No, ma'am.
Okay,
Grants works.
okay.
Maybe at Mind Matters, you might have seen each other too.
Right, right. I know we
Very
have some folks from Grand Forks that come to Mind Matters.
right.
You're always welcome, of course.
Yeah.
I take it since you're from Fargo, and I know that Fargo has a lot of TBI support groups. I'm assuming that none of them are meeting right now.
No, I think, I know Progressive Mind Matters is actively meeting once a month. I think it's the first Thursday of the month at 6 o'clock. And
Via Zoom or online, virtually. Yeah.
yeah,
Yeah.
so there's certainly ongoing ways to connect, and Carly, you would be a good kind of resource for that.
Yeah. So there's R2 and then progressives, or they call it Mind Matters. But yeah, there aren't any in person going on that I'm aware of right now. And I know that's kind of the
Do you know
struggle with
that-
JP's crew in Grand Forks doesn't really dig the virtual thing. They want an in person, and I get
Oh,
it. It's
okay,
kind of more of a safety concern at this point. Yeah, we're not.
right.
UND's not letting us really travel or really do much in-person stuff yet. So
Right.
kind of waiting. Hopefully soon the vaccines are rolling out, right?
Mhm.
Amy, what about, yeah, it has,
I was just gonna comment on, we have aphasia groups that do meet
Yeah.
in person
We
in
do.
the, at Columbia Hall. They're aphasia groups and they're more language oriented, but one is a book club and then one is a conversation group. And those will be starting the week of the 25th of January. So if those are something you're interested in, please feel free to contact me or let Carly know and she can get you my contact information.
yeah, you might enjoy that, JP. There's a good group that,
Excuse me, Amy.
Yes.
Are you a TBI survivor also?
No, I'm not. I'm a professor at UND and I'm in the speech language pathology department. I do have a child that is got some.
The reason I was saying that or asking is I just noticed a sign behind you saying you are so blessed.
Oh, yes.
And if you were a TBI survivor, that would say a lot about you. Of course, it does say a lot about you, just as is.
You know, that's funny because I put that specifically so people would see it because, yeah, I've been through some stuff. And I have a son that's got, that was born with congenital hydrocephalus, so that he has had several brain surgeries. So, but again, our groups are really, it's a really good group of people. They're very small. We still do the social distancing, especially this year. And they're free this semester because we're just transferring from a teaching clinic over to a billing clinic. So that would be something to think about if you're at all interested in either one of those.
great. Thank you, Amy. I like that. One of her other questions that Jessica had for us was, what is the most important to you when it comes to community participation? You know, when she showed that pie piece, JP, was there anything that you really connected with, a chunk of that you thought?
Well, you're talking about the presentation, right?
Yes, yes.
That's obviously for me. I mean, I'm lucky I've got my wife to keep me straight, but there's so little lack of being in touch with other people. And like I said, that's why I do miss the support group as much as I do.
Yes. So that socialization piece, probably the biggest. Do you guys see that with clients too? I see we have Lori and John on here. They're in Sanford, Fargo. We have.
Responding to Lori's question on the chat,
Oh,
what we've done at Heart Springs, I mean, you know, the only way we really survive is through grants. So we're always, or Jan is always writing grants. And, you know, like for instance, when we had Art Studio, a certain amount of the grant would go to provide transportation, but that was a huge concern for people getting to see us, and really took a fair chunk of money to provide that for clients. So grant writing, I would say.
yeah. So just to read, so I'm just going to read what Lori said in the chat just for everyone in case you didn't see it. It says, we primarily get self-report from our support group participants, and they seem to struggle most with transportation as a barrier. And what could some of the solutions to be to that? And yeah, grant writing is probably my best answer for you too, Lori. I know it's a lot of work, but Andy Bin can help you if you want us to. We can help you write a grant and find one too, because a huge part is finding the grants that are out there. But we have at UND, we have Rural Health Information Hub, which their job is to help people find grants, and they serve the whole nation. So it's not just North Dakota or anything, but we can reach out to them and say, I'm looking for a grant that would help me use the funding for my participants to get wherever. And then, you know, we could definitely help you with that at Indy Bin too. If it was going to be for brain injury survivors, we would be more than willing to do that. So you just have, yeah, let me know. Because I know I don't really have any other great solutions. I know a lot of even the agencies kind of say that that's a barrier for them because they can't even oftentimes reimburse mileage to their staff if their staff are driving people certain places and that whole thing. So it is a big barrier, especially in such a rural, I think, and where Jessica, you know, she's in Pittsburgh, so I'm sure public transportation is a lot more accessible and easy, but then yes, then they run into those older buildings and things like that. So there's kind of a little bit of give and take there, but yeah.
Carly, I guess I do have one more thing to ask and say a statement.
Yes.
And then I'll ask a question. First of all, I do feel like a dummy. And the reason is because I missed the book club. So
don't worry about it.
How that went.
Yeah.
If you didn't hear, I was asking how it went.
Book club. So you know what? I think everybody else did too. So it's only ND Bin staff that showed up for the first one, but that seems to be kind of our pattern. Like even Web Wednesdays, it took a while for people to start showing up. So I'm not totally heartbroken yet, but I hope some people come to my next month one. But we had a nice discussion. We still chatted about the article that I chose, and the article is archived on our website too for those of you that want to look at it. But it was all about this new app that they're giving to PTs, Barbara, so you probably appreciate it, but it's called Med Rhythms. And it's a music therapy app where the individual wears something in their shoe, and then they hear, and then they also have something in their ears, and so it plays a different music algorithm. And if they are in tune with the algorithm, it will make it harder or easier. It'll kind of change the beat that they're supposed to walk to the music to. So yeah, it's really interesting, and I can even actually put it in the chat for you. You can grab that off of our website if you're interested, but yeah, it's called Med Rhythms. Let's see here, grab it right now. So yeah, using digital therapeutics to improve outcomes was the article's topic, but here it is too on our linked from BIA USA. It's a pretty short, easy read too, but it talks about how, you know, a lot of PTs aren't trained in music therapy, so it's kind of a way to meet both needs to have. But yeah, it's this new device. And yeah, so they've seen a lot of post-stroke walking deficits is just the beginning, as there are many other patient populations that could benefit from this. Those include people living with TBI, Parkinson's, MS, and Alzheimer's. So, but yeah, check that article out when you get a chance. But yeah, next month we are reading a book. It's about $14 to purchase through BIA USA. It's about Brain on a String. It's kind of about trying to stay organized when you have a brain injury. You know, shopping lists and little tips like that. So kind of excited. Mine hasn't come in the mail yet, but should be here any day now. So I'll be reading away. And good, Lori. Yes, let's set something up. Lori just put in the chat. Yeah, let's do a grant. I can help you with that. I'm actually in a grant writing workshop right now, so I'm learning how to write grants too. So kind of new to me, but yeah, so I can help though, as much as I can. Rebecca's kind of a pro, but we'd love to help. That's part of our job. Well, anything else you guys want to talk about or have comments or questions on Jessica's presentation? Or
Well, I guess I do have one more question. How's your little cutie?
So I have a 3-year-old. JP always likes to ask how she's doing. She's great. She has, although, been a stinker at daycare. She was not napping for preschool. And so we've been trying some different things, but apparently she just wants to play at nap time. And I don't know. I think I don't blame her sometimes because they're all kind of napping on cots in a little preschool room together. You know, I'm sure it's very distracting. So trying to talk about the importance of sleep for her body and all of that. You know, we do that with our brain injury and clients as well. So yeah, trying to put it into perspective for a 3-year-old, but yeah, otherwise she's doing very well. Thanks for asking. Yeah. Loves the snow, loves playing outside with her boots and snow pants and all that. Yes. Oh, thank you. Amy just put her info in the chat too for everybody. If you're interested in any of those aphasia groups, there's the book club on Wednesdays and conversation group on Mondays. So she put her email in there, JP, if you want to jot that or copy that down at all.
Send it to me, that would be good.
Yes, I can email this to you. And yeah, JP is kind of our unofficial director of the support group at Grand Forks. He's kind of he keeps everybody informed, and he does send on all these things to them too. It's just, like I said, the virtual thing really isn't their thing. So maybe you will get some luck with this group. All right, JP, there, I just sent it off to you. Oh, all right. Well, if you don't have anything else for me, I'm gonna let you all go. Kind of a short and sweet one this week, but I think it's still an important topic to think about. So yeah, like Jessica said, if you do want to participate in that survey, in that study at all, towards the end of her presentation was all that info, but you could also fast forward through, or if you need her info, you could just email me too and I can get it for you. So yeah, thanks for your time, everybody, and hope to see you all soon.
Thanks, Curly.
Thank you.